The suspect's veteran status is drawing increased attention as to how the nation cares for former service members and their mental health. To discuss these challenges, we're joined by Dr. Ziv Cohen. He's a forensic psychiatrist and clinical assistant professor of psychiatry at Cornell Medical College. And he is also a former military psychiatrist for the Israeli Defense Force. Thanks for being with us, Dr. Cohen.
You're welcome.
Now, we know that the gunman served in Afghanistan. He was an infantry machine gunner for the Marines for about 4.5 years. He was also an instructor in Okinawa in Japan. And mental health professionals believed that he suffered from PTSD, post-traumatic stress disorder. Given the details that we have at this point, what is your read on this?
Well, I think that, PTSD is unfortunately fairly common in service members. Probably about 30% of service members who are in an active theater combat will have some form of PTSD or PTSD-type symptoms. But really hardly any of them, or a very tiny fraction, are going to be involved in any kind of violent behavior after their military service. So part of the difficulty in this situation is that it's a bit of a needle in a haystack in terms of trying to identify which service member with perhaps PTSD or depression or substance abuse is actually going to go and harm others when they come back into civilian life.
Let's focus a little bit more on the PTSD angle of all of this. It's defined as being caught up in a traumatic event that is overwhelming, frightening, and life-threatening, that could lead to PTSD. And I imagine that is very common for anyone in the military to face that kind of scenario. But
Sure.
as you say, not everyone in the military then developed that. Do we know why not?
So
why some are more susceptible than others, rather?
We have some information about this. So most people will be resilient, which means that they will not develop PTSD. And that's a wonderful thing in terms of the strength of humanity, and that we can undergo a lot of stress and trauma and actually not be symptomatic. But those individuals who will develop PTSD tend to be folks who had more difficult experiences as they were growing up, which is what we call adverse childhood experiences. So these are folks who may have come from a lower socioeconomic status, less education. There may be trauma in the family, like divorce or abuse in the family. So those kinds of experiences prior to going into the military will increase your risk for developing PTSD from trauma that you sustain when you're in the military.
What are the symptoms that manifest themselves when someone has PTSD?
So the symptoms of PTSD really fall under a few umbrellas. So one is the idea of re-experiencing the trauma. We sometimes think of that as intrusive thoughts. So the person can't really get thoughts or memories of the trauma out of their mind, and they can intrude on daily life and really, in a way that makes the person quite uncomfortable. Another area is that people can have what's called hypervigilance. So they're always on the lookout for something terrible happening. This is a veteran who might hear a car backfire in the street, and they'll jump out of their chair, or they'll feel like they need to take cover. And then another area is what we call emotional numbing, where people with PTSD tend to withdraw from relationships. They tend to have a more narrow emotional range, and they may often have feelings that tend to go more in the spectrum of anxiety or anger or irritability.
During the press conference, the authorities were asked by reporters whether it's known if the gunman was on any kind of drugs or medication. Is that something that is usually used to treat PTSD? What kind of medications are prescribed for that, and could that potentially play a role?
Well, so really treatment would mitigate any risk of violence. So I'd certainly encourage anyone who has a loved one with PTSD, getting them into treatment is the best thing that you can do for them in terms of improving their functioning and decreasing the risk for any bad behavior. But, and so the medications that may be used to treat these symptoms will be things like antidepressants, anti-anxiety medications, sometimes medications to help with sleep. And then psychotherapy is also really important. So I don't think that the medications could bring on this behavior, but substance abuse certainly can be a complicating factor in any kind of interpersonal violence.
Well, this is drawing attention to the way our vets are being treated in this country. They sacrifice so much, they serve, and there is concern that they don't get the kind of care that they need on various fronts. when they return from service. How do we better address that challenge?
Sure. So, well, one issue is just allocation of resources. So we don't allocate enough resources to mental health, and that's not just for veterans, but for the the civilian society as well. But certainly for veterans. Another area is overcoming the stigma of mental illness.
Right.
Most veterans, it's only going to be on the third or fourth or fifth encounter with a medical professional that they're really going to admit that they're having difficulty, because there's a culture of being tough. So that's another area. And finally, I think that at times we may need to be very careful about who we commit to the hospital, that there are cases where we need to be a little bit more aggressive about making sure that we hold people for a long enough period of time to get a good look at them and understand what's really going on with them.
Very quickly, being involved in the Israeli Defense Forces, are there any comparisons or useful parallels that you can draw in how this should be handled?
Sure. I think that, like the American military, the Israeli military has a very forward-thinking posture when it comes to mental health. I think that one of the advantages that Israel has is that it's a small country, and so community tends to be more intact for veterans when they come back home. Mm-hmm. They're not serving far from home. They're not going to Afghanistan. They're serving maybe an hour away from their home. So those things help to make people known and to make people more easily identified and brought into care.
Okay, thank you so much, Dr. Ziv Cohen. Appreciate your time and, of course, your work. Thanks for being with us.
Great to be here.